In partnership with cleveland.com, this is Capital Letter. The state is lifting closures as the number of cases and deaths appear to be on the decline. But an Ohio hospital says the number of cases could rise as more businesses reopen doors to customers. Cleveland.com political reporter Seth Richardson joining me now with more on the new modeling that could make or break the state's effort to reopen the economy. Seth, MetroHealth has some new modeling. What's it showing?
Well, basically what it shows is that we'll likely see an uptick in cases as the state reopens because person-to-person contact is going to go up by, as much as 200 to 300%. And what it's basically showing right now is that we'll see a peak of cases coming kind of at the end of the month, right around 900 cases a day. Currently, we're at roughly 500 cases a day. After that, though, it should, assuming people still practice social distancing, wearing masks, that kind of stuff, you'll see that taper out to around just over around 200 cases a day by the end of June.
And that's the major caveat here, isn't it? That it assumes that people are going to continue with the social distancing efforts that have been underway for the last couple of months. But if last weekend is any indication, some people are going to be less than enthusiastic about continuing those measures.
Yeah, that ends up being the big question here, right? Do people continue to wear masks? Do they, limit how much they go out to bars and restaurants? We saw images from all over the state showing, crowded patios, crowded bars, not social distancing, people standing in crowds. So that is going to be basically the big factor. And, I think you've heard that from Governor Mike DeWine and Amy Acton every day, that is sort of the key to being able to kind of exit from the, both the health crisis and the economic crisis at play, right?
What progress has the state made against the virus since those social distancing measures and stay-at-home orders have been in place?
Well, you can just follow the trend lines and you can see that, cases have really kind of, flattened out and even sort of started to go down a little bit. Some of the other things that they've been able to do, they accomplished increasing hospital capacity. Part of, what MetroHealth said with the modeling that was released today is even with the, a possible increase in daily cases, they don't think the hospital system is going to be overrun. And remember, that was always the biggest issue, is that there was going to be hospital capacity to treat what could have been a run of patients. But with hospital capacity being increased, it looks like that is no longer a threat. The state's also been working to increase their testing so that they have a better idea of who does have the disease or who might have had the disease even with antibody testing.
Seth, clusters continue to be the driving force behind the virus penetration here in Ohio, places like prisons and nursing homes. Is that pattern expected to continue based on this new modeling?
I don't see any reason that it wouldn't be. The modeling itself didn't directly address that, but when you look at the places where there have been hotspots and, even just clumps, right? It doesn't have to necessarily be a giant hotspot or anything. You've got prisons and congregate living and nursing homes and long-term care facilities. And, I think it's kind of safe to assume at this point that if the virus does infiltrate one of these places that is kind of, close living situations, then it is probably much more likely to spread. You've seen that with, Marion and Pickaway prisons being the kind of prime examples, some of the highest infection rates nationwide at one point. So I don't see any reason that wouldn't continue, especially in these places where people are in close quarters together.
How reliable are these models, given the fact that the results can vary wildly, as we've seen in the past?
Well, I think the important part is the vary there, right? And it's a model, so it's never gonna be exact almost most of the time. It's kind of like polling in a way, right? Polling doesn't necessarily give you the exact outcome as it is going to be. It gives you a likely range of outcomes within a certain degree of confidence, and that is basically what modeling is. The epidemiological modeling is they're basically saying, hey, these are kind of the most likely outcomes within a 95% confidence rate. So you can be pretty confident in that, that some of the modeling is going to show you some result that is accurate, but it's not necessarily going to be right exactly on the trend line, because that is just incredibly hard to predict with so many factors at play.
Thank you, Seth.
Thank you.
And remember, you can have Capital Letter delivered to your inbox every morning simply by going to cleveland.com/Capital Letter.